Lyme disease. Um, so Lyme disease is a bacterial infection, uh, and it's the causative agent is a spirochete. It's a type of bacteria. The two spirochete diseases are syphilis and Lyme disease, and they actually have a lot in common symptomatically, um, and in the course of the disease. So um, it's a vector-borne disease. It you get it be, by getting bitten by an infected deer tick. There's a couple of different types of deer tick that carry it, and it seems to be endemic kind of in the Great Lakes states, in the Northeast, into the Mid-Atlantic, Wisconsin, Minnesota. So they call those the Great Lakes states. Um, it's uh, any place where there's ticks, you can pick it up. So, presumably Southern Ontario qualifies as this sort of a thing. Now, the it's in your textbook on page 158, all the way um, to 160. Now, it was named after Lyme, Connecticut, and it was first recognized only in 1976. Now, did it exist before that? They don't know. There's, the conspiracy theorists have it that it was carried by birds and then to ticks from a U.S. military base where they were experimenting with biological weapons. I don't buy that, but that's a very strong prevailing theory. I know a few people that have Lyme disease, including my brother. And so through him, I know a number of other people that have it. Um, it's a very, very, very controversial disease. It's very difficult to diagnose. So uh, it's saying there's 20,000 diagnoses a year in the U.S., and we see it in Europe and in Asia. It's like New York State has about 10,000 per year. Ohio has 5 or 6,000. Michigan has 4 or 5,000, and then the rest of the states have a couple of thousand together. New York State seems to have a lot of it diagnosed. At the same time, in the same time frame, Southern Ontario has in the neighborhood of 50 or 100 diagnosed cases. So there's only one of two explanations of that. Either ticks don't get passports and they can't come across the border, or there's a problem with our diagnostic criteria in Canada, or they're either overdiagnosing it in the States, or we're really severely underdiagnosing it in Canada. So you get it from these guys, from the ticks, deer ticks. They bite you, they bury, they drink your blood, they pump their saliva into you so that your blood doesn't coagulate, so that it keeps on flowing and they can drink it. Um, and that saliva has this spirochete in it, and you end up with Lyme disease. Um, so they pick up the uh, the Borrelia burgdorferi from um, from other animals, usually deers, but it can be any mammals, and they pass it on to the next animal that they bite, and it could be a human. Um, Very slow growing bacteria, and it goes all over the place. It invades tissue and it eludes the immune system quite well. So when they first get bit, the stage one, it's called the early localized stage. It occurs within days after the tick bite, and about 80% of people get a rash, right? And it's called a bullseye rash. They tend to get fever, night sweats, stiff neck. Um, if it wasn't for the rash, and so the 20% that don't get the rash, uh, you would think that it is some sort of a viral infection, the flu or mono or something like that. But if you do get the rash, that's kind of pneumonic, and it's a bullseye rash. It resembles ringworm, quite frankly, when you see it, and it happens around where the tick bite is. So you can see it here in the on this woman's back. So after that, it turns into disseminated disease. So that's stage 2. So it's within a couple of weeks, and it spreads to the heart and to the neurological system and to the joints, the nervous system and the joints. It says in your textbook, neurological symptoms may be the first to arise and occur in 15% of all cases. Most commonly, mild headache, stiff neck, difficulty with thinking, cranial neuropathies, Bell's palsy, radiculopathies, that kind of thing. Forgetfulness, but really trouble understanding something. These people get fatigued. Their hearts start to race or get skip beats and stuff like that. Blood pressure is all over the place. So that happens in this stage 2 disease. It says in the book here that half of those diagnosed may go on to develop painful Lyme arthritis, characterized by unilateral inflammation and swelling in the large joints, especially the knees. And so in this slide, it's saying infection of one or more joints, knee, elbow, shoulder. Usually 3 joints or fewer. It looks a lot like rheumatoid arthritis because it is an inflammatory thing. And the symptoms subside after a little while. Then it turns into stage 3, a late persistent infection. And if it's left untreated. Now, the slides don't reflect this, but the book does, and my understanding of it does. It's saying that weeks to months after the initial infection, 60% of individuals left untreated develop stage 3 symptoms, characterized by intermittent arthritis associated with marked pain and swelling, especially in the large joints. They may go on to develop erosions or permanent abnormalities. That's a fairly well accepted thing. Now, your book on page 159 goes on to say there are post-infection syndromes, and this is really very controversial. There are a lot of doctors, and the Canadian Medical Association denies that this even exists, although most of the American Medical Association does accept that this exists. It's controversial, but they're called post-infection syndromes. So it's persistent symptoms despite antibiotic treatments. It's post-Lyme syndrome, chronic Lyme disease. It looks like chronic fatigue or fibromyalgia. These people get really very debilitated. They get horrible fatigue. They get headaches. They get joint pain, cognitive difficulties, night sweats and sleep disruptions, that kind of thing. And it goes on forever. Like, it goes on for a long time. And what happens with these people that have this chronic Lyme is nobody believes them. And They don't fall into the criteria um, of chronic fatigue or fibromyalgia. That it's not positive for anything, and so they usually get diagnosed with psychosomatic or some sort of psychological thing, and it and years into it they really have trouble with it. They get depressed. A lot of them can't work because of the debilitating lifestyle that it is. Now the problem here is that by this kind of post Lyme disease state, there's no serological evidence. They can't. It's very difficult to find the bacteria. There's really no sign. So is it become a an autoimmune thing because of it? It's really very early for they don't really know yet. Um, so if it's treated early with antibiotics at the time of the rash, then people don't go to this extent. But if it's kind of okay, maybe it'll go away, and it does go away, then it can develop later. And that's one of the problems with the spirochete diseases. Even syphilis is like that. The initial rash and infection only lasts for a little bit, and then it goes away. And then even people with syphilis end up with kind of arthritic pains, and they get a disseminated disease, and that's a problem. And then that kind of goes away and gets better, and then it comes back later as a chronic neurological debilitating thing. And I mean, people with syphilis end up literally going crazy. They become mentally ill with it. And so it's not a long stretch to think that Lyme disease is doing the same thing. So the diagnosis is horrible. The blood tests that we do in Canada for it are notorious for missing it, apparently. There are some blood tests that you can get, but you can't get them in Ontario. You have to pay for them and send your blood off to the States. The problem is that it's not false positives, which is a big problem with most blood tests. The problem is false negatives. People that have the disease, but test negative for it. Once you test negative for it, it's very difficult for a doctor to repeat the test, because it's like you tested negative. You're just, you're being paranoid, sort of thing. And it's hugely difficult to figure out. So, so if it gets diagnosed, and it's diagnosed early, then the thing to do is some pretty high grade antibiotics, and they have side effects to them as well. The big problem is that the antibiotics don't really work in the late disseminated disease when you get the neurological symptoms and that kind of thing, and definitely not in the post Lyme disease, the chronic Lyme disease stage. So the best thing to do is, if you're in a tick-infested area and you're out in the bush a lot, is to be very careful. Like, you don't walk through the tick-infested bush with short sleeves and shorts on. Use insect repellents. You want to remove the ticks that you find on yourself. It's a problem. There are special ways of removing ticks, and I'm not even certain of them. I've heard that you should put a thread around their heads and pull them out by the head. I've heard you should burn them off. As far as I know, tweezers or the thread method actually gets the head out of the bite wound. If you just pull them by the body, you're going to leave the head in, and then that becomes a real source of infection. These people get musculoskeletal complaints. They have arthritic complaints. They have painful muscles and that kind of thing. you have to be very careful when you're working on these people. When they're in that disseminated arthritic place, then it's probably not a good idea to work on them. But at other stages, and especially in the chronic late post Lyme disease syndromes, you probably can do a lot of good. These people are very anxious and they're very sensitive to things, and massage is indicated and is quite helpful.